I apologize. I'm going to rely on my script a little bit more than I'd like to, but I'm very honored to be able to introduce my colleague, David Rothwell. As you know, professor in HDFS and the Barbara E. Knudsen Endowed Chair in Family Policy. And as the chair, he leads the Family Policy Group, which is comprised of students and faculty who want to advance the study of family policies such as poverty, childcare, paid leave. If you'd like to learn more about that, feel free to talk to him afterward, or I'm happy to help too. I'm sure you're going to have lots of questions. He also leads the Oregon Family Impact Seminar, which connects state policymakers with national research experts. In 2023, with HDFS graduate students, Inez, where's Inez? Inez and Viola and Beth. I'll just give you all a shout out. I think it was a very successful event that David and I co-led on family and youth mental health at the Capitol. David is an expert in poverty, families, and social policy. Recently, he was interviewed on KLCC's Oregon on the Record to discuss barriers to making progress on the war on poverty and promising solutions like universal basic income. We're fortunate to have him here today to share his involvement in the 2020 to 2025 cohort of the Family Self-Sufficiency and Stability Research Network. It's a mouthful. Everyone, David.
Can everybody hear me? Assuming you can hear me online. Susan will let me know if not. Welcome, everybody. It's a pleasure to be here. Thanks for spending your Friday afternoon of week 7 here. And I'm going to talk about work in the safety net among first-time mothers with some lessons for family policy. So I'm going to go through this research network, the partnership model, share some background on why we're studying what we're studying, some findings from a couple studies, and then some implications for family policy. But before doing so, I want to just pause and acknowledge and take a second to just reflect on what's going on right now. The work that I'll be talking about is heavily based in partnerships, university government partnerships with a lot of civil servants. And as of yesterday, there were 200,000 workers in 12 agencies that have been laid off. So I know we're all focused on research indirects, NIH money, and research projects, but this is also affecting the livelihoods, careers, and well-being of over 200,000 workers and counting. These are colleagues, friends, former students, and so that's where my mind's at. I'm sure you're a little bit in the same, and so I just want to call attention to that we're in unprecedented times. So moving on, just a little bit about my work and my background. So I work on children and families who are experiencing low income and poverty, and I particularly am interested in the policy efforts that are designed and implemented to affect those children and families that are experiencing low income. So that's my background in a nutshell. This project is called the Family Self-Sufficiency and Stability Research Network. Yes, Kelly is right. That's a mouthful. It is, I'm lucky to be part of the second cohort of this funding from the Department of Health and Human Services through OPRE, the Office of Planning, Research, and Evaluation. And the mission of this group is to conduct rigorous policy-relevant research developed in collaboration with practitioners and policymakers to address socially structured inequalities and injustices that impact families with low incomes and improve economic stability. That's the mission of the group. Lucky to be with other scholars in New Jersey, North Carolina, California, and Michigan. It's a 5-year project, and the work I'll be describing today is through this mechanism. I highlighted these two parts because each scholar is doing their own projects, but we're also doing collaborations across these, and I'll highlight one example towards the end. So this is the background. Thinking about university government partnerships, that's what this funding mechanism is all about, and that's a lot of what my work is all about. The last time Marie invited me to come and talk to this group, it was, I think, in 2019, and I was talking about the Oregon Poverty Measure that we developed to create the most valid measure of poverty in the state of Oregon. That work involved numerous partnerships with Department of Human Services, Employment Department, and so on. Building off of that is this FSSRN network, which is much bigger and involves many more people. So I'll just go through here in a clockwise order, but we have the Oregon DHS, which provides the data on the welfare programs. Oregon Health Authority is where the study begins with the birth cohort. So we use the birth records, collaborating with researchers at WIC on the qualitative component of the study, which I'll talk about. Oregon Employment Department, OPRE, some of those are self-explanatory, I hope. ICF is the organizing group that facilitates the group work among the scholars. The Oregon Parenting Education Collaborative, OPEC, Shauna, this was Shauna watching. Hi, Shauna. Shauna was really helpful in helping me plan this study, and she supported it. And we've used that for some recruitment. And then I've also partnered with data scientists at Chapin Hall who moved to the NORC NORC at the University of Chicago, and continuing to do some of the nitty-gritty data management work with them, and they're excellent. So, the spirit of this collaboration is really to lean into academic theory and skills to promote and generate new knowledge that will be policy relevant. That's what we're doing. So, some background on the subject matter, which probably brought you here today, which is this transition to first-time mothers, work, and safety net. So just some background on what I think about as really fast social change in society. So these two graphs go back pretty far in time, 1948 or 1975, and they're just showing something very basic. The percent of women who are in the workforce is the highlight. So regardless of whether you're looking at mothers on the right or all women on the left, you can see that in 25 years or 50 years, going back 2 generations, think about your parents, you as a child or your parents' generation, family life was different in many ways. And one of the biggest and most substantial ways is that there was a lot less women in the workforce. So in a pretty short amount of time, we have many more women and mothers that are working, and this has implications for all types of things in how families manage care, their identities, how they their livelihoods, and so on. So there's a whole bunch of implications that my colleagues and others are studying aspects of. So we have fast change in family life and slow change in policies to adjust to those. So the economy and family life has changed dramatically in a generation, and our policies have been really slow to catch up. So just one example that I'll return to at the end is this idea of paid leave. So the map on the left shows a world map of all the countries and shows a gradient of how much paid leave is provided. And you can see that there are 2 countries that stand out as providing no paid leave. Papua New Guinea is one, and the US is the other. So, it's I know it generates some giggles, but it's not much to be proud of, probably. We can do a lot better. So, anyway, in the absence of a federal policy, states have started popping up and providing their own paid leave. California famously introduced the first state paid leave program in the early 2000s. And along the course of this project, I wrote a brief kind of describing some of the elements of these policies and specifically how they can be used to reduce inequality. Even since this came out a year ago, I think at least 2 other states have passed laws. So it's a rapidly changing policy environment. But anyway, we still have many millions of families that are not covered by paid leave today. And so this is just one example of how policy has not kept up with the pace of change. So what does this mean for families? I provide one of my favorite clips here of an auto office reply. Claire Kane Miller is a journalist for the New York Times. It does great work in this area of family policy. So if you're a parent, you can probably identify with this out of office reply. And you probably have been working on a reduced work schedule for some time. Other scholars in this area of work have had more other quotes, such as, whereas other countries have safety nets to balance this change in family life, the U.S. has women to rely on, and so there's a big gendered element to this. So this is all going on. What do we do? What do we do about it? Some people argue that we should lighten the demands at home, and there's a lot of interesting work going on in this space around maybe if we provided universal preschool, longer school days. I know I don't see Kathy here, but the idea of shorter school days but longer 4-day weeks has some implications. Negotiating domestic roles. There's a lot of things that could be done at home. There's also things that could be done at work, and I know Kelly is an expert in how workplaces can change and be more family supportive. There's things like parental leave, predictable hours, and work schedule flexibility. So these things are happening. These things are lots of people working in this space. What I'm going to talk about is specifically for low-income families, how we can think about the safety net and how that could be changed. And I'm going to start with some descriptive work on TANF and work itself. So far, so good? Okay, so this paper came out in December where we just I'll get into it and we'll show some of the findings, but made the case for temporary aid for needy families as a type of family policy. So what's going on around birth? What I talk about in the paper is that this represents a critical life course transition, obviously going from not having children to having children. I've experienced it twice over the course of this project. Been on 2 parental leaves myself, and I can speak to that lived experience. But it also involves intense changes around identity, who you are as a person and as a family member. It involves changes to your employment, how you think and do care, how you manage your time. It's a big change. And I'm specifically, with my interest that I talked about earlier on, I'm interested in how this affects the economic resources of a given family. And so this is a really good paper showing 12 months before birth and 12 months after birth. And a lot of the things I'll show you today are centered on birth at 0 or in the center. Okay, so this is kind of average. This is average over a pretty large sample. Your income starts dipping as you approach that birth event, and then it's at this low point, it's 30% lower than it was a year before. It's a large change, and it doesn't recover. And basically, you're adding a person to care for, feed, and so on that needs resources, and you're losing money. So you're both losing money at the same time you're adding demands, which creates this large decline. You can imagine for people that have good jobs, like in universities, and this is an easier change to manage. But if you're on low income, you can imagine how difficult that is. So this is the background and what we're working on, the background pattern. And so we're going to look at TANF as a way to adjust that curve a little bit. So a little background here. I'm not going to go into it in great detail, but temporary aid for needy families, TANF, was created in 1996 when Bill Clinton supported ending welfare as we know it, converted aid to families with dependent children, AFDC. It changed in many ways at this time. It went from an entitlement program to a block grant delivered to states, which means there's tremendous state variation in how TANF is delivered. It's means tested. You have to have income below a certain threshold. And it implemented these time limits. So lifetime time limits, you could only be on TANF for, let's say, 5 years. And it embedded work requirements into the receipt of the cash assistance. So you had to be working or seeking work or in some type of job training. So it really changed. There's a lot of literature on this change and studying it. I argue that this is a family policy because of a few reasons. Eligibility largely requires pregnancy or presence of children, making it a two-generational approach to policy. This is kind of in the weeds of policy analysis, so forgive me a little bit. But in the eligibility, it differs from other things that we think of in the welfare state, like SNAP and Medicaid, because those are based on individual eligibility criteria. TANF is based on the family and household unit. Importantly, in this space also, it is the only program that provides unrestricted cash to be used by families in a month-to-month basis. So the whole array of other social welfare programs, think about SNAP, for example, you can buy food with that. You can only buy food. You can't, if your kid needs to go to a birthday party and you need $20 for a gift, you can't buy that gift with your SNAP card, right? So you cannot use it for other things that are important to whatever it is your family cares about. So TANF is really important in that way. And just to give you a ballpark of the level of money we're talking about is for a family of three, $500 or so. Definitely not going to lift you up. Definitely not going to lift you above the poverty line by any stretch of the imagination. So this comes off a little bit like I'm like pro TANF and I love TANF. I recognize that it's extremely low amounts and there's a lot of problems with how it's administered. Okay, so also, without drawing you into the literature of this space, I just want to summarize that prior work on this topic of TANF around the time of birth is limited by a few factors, like pretty small samples, looking at all births, so not considering that transition to first birth. And so we know that like having a second or third child complicates the story of how you use the safety net in relatively short time windows, like maybe a year following birth. So we try and add to that story a bit in this study. So ask a few questions here, largely descriptive, but interesting descriptive. Among the low-income population, who enrolls in TANF and when? So this is a timing question. We do some clustering around trajectories that I'll tell you about, and then we look at what are the factors associated with those trajectories. Okay, getting to the fun stuff. This study used linked administrative data from Oregon Health Authority, Department of Human Services, and the Employment Department. I could talk a long time about the matching process, but it takes the social security number, the name, and the date of birth from the birth record and links it to those other records. And people within DHS did that. And then they sent us de-identified data with a unique ID that we were able to merge together. The graph shows the cohort design. So it was all births in the state of Oregon in the 2 years of 2016 and 17. Maybe some of you might have a child in the data set. I don't know. Eileen does. Great. Okay. So the green is like we followed mothers 2 years before and 2 years after. Okay. Another kind of detailed diagram, but just to show all the decision points that happened as we worked with the data. Helps to start in the middle, where when we linked wage records and welfare records together, it was 82,000 unique birth or unique events, unique birth records, but 1.64 million person months when you look across all the data. Limited it to first-time single births, which dropped it down to 33,000. And then I don't talk about it that much, but it's kind of important to think about Medicaid at birth as a proxy for low income. So this is the analytical sample that we're kind of looking at is this 12,000. We're looking at the 3,000 when we exclude the employment-related daycare, 3,200 mothers who used TANF among the low-income group of 12,000. I hope that makes sense. It's a little complicated, but that's where we are. Measurement is really basic. It's binary, like were you on TANF in a given month or were you not? Some age, education, race, ethnicity, and marital status. And a real value of this is that we were able to incorporate work histories. The methods that we use are kind of fun, and this was a new space for me, so it was fun to learn these. To use sequence analysis, which is used to understand life course trajectories in totality or in a whole, rather than looking at just time to event like a typical survival analysis. We'll look at how long were you on welfare until you exited, right? Well, this is looking at on, off across a given time period. Once you have those sequences analyzed, you can then cluster them into groups and look at different types of pathways and trajectories, and that's what we do. And then basic multivariate regression to look at how those varied on characteristics. So here is what is called a sequence index plot. This is all the people that participated in TANF during the study window, and you can, it helps if you read left to right and you think about this, the gray areas as not on TANF, and then the pink areas are episodes or on TANF in a given month, 24 months before and 24 months after. So, if you look at enough of these, you can start to see some patterns there, but perhaps this one is a little more helpful, which kind of reshapes that into like basically a histogram by month of, the proportion of people who were on TANF in a given time. And you can see that there's this huge 5-fold increase that happens right around the time of birth. So a bunch of people get onto TANF right around that time period. TANF is family policy. That's the argument we're making. Okay, the clustering is really cool too. So we did all the things, 3, 4, 5, 6, 7, analyzing it this way, that way. This was the best fitting model in terms of the cluster fits, and produced these 5 groups. So I guess I'll start here in the middle, because this is where most people fell. About 2/3 of the people fell into. This is kind of surprising to me. No one's ever done this before. So this is all totally new information. To see that 41% of the people in Oregon in that time period were on TANF right around birth, and then they were largely off of it by 6 months later. So there's that group, and then this group is kind of the same pattern. You see this bigger magnitude, but you look at around, just after a year, and most people are off. So kind of make the argument that people are using TANF for relatively short term around the time of birth. There is these other groups, which are interesting in their own right, but they're quite different, right? There's the long-term users, there's people that get on later, and then there's the groups that gets on at birth and stays on for a long time. So just a summary of what we find here. Over 1/4 of low-income mothers use TANF, and that large group is using it as a short-term support. And what we would think of in the scholarly community here is using TANF as paid leave, like a short-term exit from work, and then we're off. Yep.
Ask a clarifying question
Yep.
quickly about just to translate this. If you gave the $500 a month for a family of 3, but if it's a first-time mom, you're saying it's paid leave, but how much money is that?
It's a good question. The dollar amount, like maybe $300 to $400.
So basically, we're getting for their paid leave, they're getting $300 or $400. We're talking very small amount.
Very small amount.
Okay. Yeah, sure. I just wanted in context.
Thank you. Yeah, good question. So you have to understand that people, you have to understand low income work is very low wages and often probably wouldn't have paid leave. So it's a hypothesis. We cannot confirm that people are taking it as paid leave, but it's it's suggestive of that. Those other off groups are there's clear patterns of social disadvantage there. So these are younger mothers, lower levels of education, and much less likely to be married. So that's going to put you into these other categories, even of the low income group. So, okay, so you may be thinking, well, that's nice to know about TANF. What about work? So I'll tell you. So we worked up this paper that is in progress. This is like very drafty, but we're calling it Social Causation, Health Selection, and First-Time Mothers Work After Birth. And we ask questions here. How often do first-time mothers return to work? To what extent is this associated with pre-existing social disadvantage in the public health literature, sometimes discussed as social causation? We also look at the role that having a child with poor infant health has in returning to work, and we kind of try to systematically contrast these two explanations for why people would return to work sooner or later. I'll get there. Yeah. And then we also add on some safety net information here too. So there's a lot going on here. Here we go, Marie. So the social causation factors, there's not a lot. So administrative, I'll get to this later, but there are some great things about administrative data, and then it doesn't have all the details that sometimes you'd like. So this is making the best use of it as we can. So for social causation, we decided that education levels, employment prior to birth, Medicaid and WIC at the time of birth are saying something about your past social position, right? And then having a child that's low birth weight or in the neonatal intensive care unit is a challenging health event for you that may prevent you from returning to work. I think it was about 11 or 12% were in this category, and 30. Anyway, I can't remember the percentage for the other group. I should have that up here. Sorry. Outcomes are. We looked at a lot of things. There's a lot of models here. This is really an excerpt of the results. But we looked at work and no work as an outcome, and then we also have hours data, like hours in a given quarter, in the employment data. So we were able to create like basically full-time, part-time, or not working. And this is unique to Oregon. A lot of other states are jealous that we have this data, and so it's fun to work with. And then we look at income sources. So once we have work and we have safety net, we can look at the joint distribution of those. So work and the safety net only, no work, and so on. So here's the patterns we see. One on the left is great. Maybe if you're looking at it close up, but I'll maybe just stick to here. You see this safety net only, the green line, really increase around birth. You see the amount of people working only strongly decline. And then work and safety net is increasing, but not a terrible amount. So that's the overall pattern that we see. So to the research questions, which factors matter more? And we find pretty strong evidence that those social causation variables are the most influential. You can see that they're the farthest away from the predicted average likelihood of return to work. So, for example, on the left, at year one, when you had no employment history in the year before birth, you were much less likely to work. Education is similarly strong. When we examine poor infant health independently, and so controlling for the covariates, it had an independent association, but when we include the other social causations, it kind of drops out. Okay, so strong social causation and small impact of infant health. Yeah.
Clarify for me.
Yeah.
Like are you seen as working if you take leave? Like, you know what I mean? You're on leave, but you're still employed. Are you seen
So this is, I didn't go into the detail. This is, if you had earnings in a given quarter, the employer is required to report that to the employment department.
So if you're on leave, but you're taking like sick leave, you're still earning.
You would still be earning.
So you would, even though you're taking care of a child, you're on sick leave, you're still earning. So you'd still be as working.
I think so. Yes. Yeah.
Okay.
Yeah.
Sorry.
Yeah.
Yours was.
Yep. So there's once you get into the details on how leave is going to take place, it becomes a little more complicated. So where this gets interesting is the interaction. So poor infant health is on the bottom, the blue and the red triangle. We can see here that those not on Medicaid, their likelihood of working at year one is 66%. And there's no difference between if your child had poor health or not. But if you were on Medicaid at birth, there's a 7 percentage point difference in that probability. So, the takeaway is that having a child with poor health is functioning differently depending on your social position. Anyway, there's a lot more graphs. This is just one of them showing the same pattern, just on work and safety net. So no influence for working only. If you had no work history, there's a big difference for poor infant health. Same for safety net. So takeaways from here, mothers do work less. Definitely the evidence suggests social causation matters a lot more than poor infant health. But we're actively digging in and trying to interpret what this means on the moderation effect of, having a child who is low birth weight or in the NICU seems to have a different effect depending on your social position going in. Okay. The slide I promised, and I should add Megan's point probably to this one. But there's a bunch of benefits to working with this kind of data. It's really fun to think about population outcomes. It's, compared to any survey that you're used to working with, this is not a sample. This is the whole every birth in Oregon. Some of my students are here. You'll be happy to see that we were talking on Wednesday about classical test theory and measurement, John. And that, there's no measurement error on whether you got TANF or not. Like it's actual, it is the data. You have to have a little background, but in surveys that ask people, did you receive welfare, 6 months ago? The recall's poor. People tend to under report that. And it really affects these things when we're talking about the economic well-being of families. So here we're dealing with the actual data. We haven't even talked about the amounts that they're getting or, so far it's just, were you on the program or not? Another really cool thing that we haven't taken advantage of yet, but there's coverage of really small groups that aren't adequately sampled in other surveys. And this has really strong equity implications. For example, indigenous native groups, they're often, they'll be in your survey sample, but they're so small you can't generalize or represent. Well, everyone is covered here. So about 96% of the salaried civilian workforce is covered, which is really pretty good. Limitations, the biggest one that I think about is we don't have information on the partners, and we know that going back to work is largely dependent on the whole story. So that's that's hard to overcome without some new linking process we don't know of yet. There is a large proportion of the mothers that are not working or on the safety net. They just show up in the birth records only, and they're just like around 20% are out there. So that's interesting. And then, of course, there are a few groups that fall into the 4%, but if you don't have a social security number, working in the informal economy, self-employed, and so on. You're not going to have your wages reported here. Mhm. That's right. That's right. Unless there, like I said, unless there would be some, but what, choosing.
What are you going to make of that?
Yeah.
Look at that. The partner, but do they contribute?
Yeah. Well, and it changes over time. And then don't even, we're talking about longitudinal changes, right? Yeah. So, okay. So, I said at the beginning, I was going to mention this partnership. We're, with the other scholars in the group, we are publishing briefs and things on this the nature of the work, partnering with state agencies and so on. We're also using some national administrative data to look at TANF during COVID and so on. Okay, so family policy implications. What does it all mean? I hope we're doing okay on time. In many ways, when I shared this, I guess this is an anecdote. When I shared it with DHS, they were like, well, great, it's working as it's intended, Well, people are enrolling in TANF. Like put this statistic in perspective. The national rate of poor families that receive TANF is around 20%. So remember I said there's state variation. In Mississippi, it's 6. So 6% of poor families receive TANF. In Oregon, it's 40. It's double the national average, right? So anyway, I don't want to put words in their mouth, but that is what they told me. So, to them, like one in 4 poor mothers is getting on this program. It's, one interpretation is that it's working. Okay. But it's been 30 years since TANF was created. 2026 will be 30 years, and it's time to revisit the safety net for low-income families. So the things that we think about are extending the eligibility period. So I may have mentioned, but in Oregon, in this progressive blue welfare-friendly state, you cannot be eligible for TANF until the 9th month of pregnancy, whereas in many other states, even more restrictive states, it's when you're become pregnant. So this is like my first policy recommendation when I get asked is, why don't you make pregnant mothers eligible? There's other ways to relax requirements on work and age of youngest child exemption to make this work for real families today. I think there's also policies are needed to target the socially marginalized, those groups that come into birth already in a difficult social position, low education, erratic work history, and so on. And these need different and creative policies. Is not a great example of what to do here. And if we think about this huge bump in TANF and then off as indicative or suggestive of a paid leave, what if there was a state that was doing state paid leave? Well, there is. Yeah. When we started this project, it was 2019. This had just been passed in the legislature. I had great ambitions of studying it. COVID happened, which delayed the implementation. It's only been, people have only been receiving benefits for about 1.5 years now. And so it's pretty new in terms of the policy landscape, but I just thought I would provide a little teaser here for maybe my next talk, which will be more focused on this. Paid Leave Oregon, if you haven't heard of it, provides over 12 weeks of paid leave for parental leave. What's unique about it is that it's 100% wage replacement for low-income families. This is really important. In the California example, when it started, was only 55%, right? So at the time, Oregon's was the first and most generous to cover wages for low-income families. Just to put it in perspective, a minimum wage employee would be expected to get $600 a week. I'm almost done, sir, and then we'll go to questions. $600 a week versus what do we say, $400 or $500 a month. So here's that dip in resources that I talked about. This is what TANF is doing, is it's covering that dip a little bit, especially around that time. And then, but Paid Leave Oregon is gonna essentially eradicate that gap here. That's the idea of wage replacement, right? So a lot of opportunity to study here. If anyone's interested, I sure am. Some of the things, we can think about rational choice theory. Do the benefits outweigh the costs? That'd be an economist way to approach it. I think there's also things that are going to push people to Paid Leave Oregon, and that is there's a lot less stigma associated with paid leave than there is with welfare. I will say I'm part of a network of researchers in Oregon thinking about these things, and there still is a lot of administrative burden to get on to paid leave. There's a lot of kinks to be worked out in the implementation. Next steps, we're doing more of the sequence analysis with more of the safety net data. We do have a qualitative study that's hopefully going to go to the field in the late spring and summer, and future work, like I suggested. So that's about it. Thank you.
We'll open up the questions, but I just wanted to build on that. I always tease, like, you just love your figures, but given how complicated things are, it really just puts things in stark perspective. And also, given our overlap, it made me think of Caitlin Collins, who said, we don't need work-family balance, we need work-family justice. And so this is definitely relevant to working families. Sorry, I decided to put in my little thing there, but I do appreciate your presentation. So maybe I'll take one question here and then just let me know all the forth that you have.
And the question that was raised there, it mentioned that the maximum paid leave was like more than $1,500 a week. That's $75,000 a year. Is that considered low income in Oregon?
No, that's for an upper income earner.
But I thought the program was for low income.
No, that's for all workers.
Well, it says over there 100% wage replacement for low income workers.
Yeah, I'm just adding that point that, like, the way this policy is structured is to cover all of those wages for low income. Once you go up, so minimum wage, median income, and high income, you're if you're not going to get 100% wage replacement if you're making over $100,000 a year.
That's my question, but said for low income workers. Yeah, I was wondering what.
I can see why that would be confusing. Yeah.
But I have another question. I'm going to be controversial.
Sure.
Do people have a right to have as many children as they want?
Yes.
And once they have children, who's responsible for taking care of them?
Yeah, I think that's a little beyond.
We're talking about policy. We're talking about policy.
Yeah.
That's not a policy, is that?
I think that's very valuable political people stuff like that.
That's my question.
No,
It seems like there's an assumption being made behind all this, and I'm just questioning that assumption.
well, I think it's great to question. This is the place I think to have that debate. And I think it is. I don't know how it's ever been that either.
It's an assumed value,
Well,
and I'm questioning the fact. I'm questioning whether it's a valid assumption.
here.
Yep. Okay, start.
Sorry, I'll sit down. It's fine.
My question is for the people who were using Medicaid but did not use TANF. Did you have any interesting findings about them in context of like their work or their education or how they were faring after the birth? And also, who do you think these people are? Because these people have SSN, they have the need for social safety net, and they're still not using TANF despite using Medicaid. Just like in your experience, do you know who this population is?
So you're asking about the low-income mothers who didn't use TANF? Yeah, that's a great question. That we've been so focused on who is using it that we haven't looked at that. I think there's a lot of work that's gone into the barriers and the reasons why TANF is a a lot of people don't want to go through that much trouble for such little reward, and so I can imagine there's a whole range of of reasons why people aren't moving forward. But stigma and administrative burden are two in one.
I think my question is related to this, and I suspect that people aren't using TANF because they don't qualify for it. I mean, I'm curious about our qualification of what low income is, because if you're using TANF, my experience working a homeless shelter, you're like what I would call extreme poverty. Like you are not working barely at all. Like you do not qualify. And so I'm really curious. But you can, if we live in Oregon, you can qualify for Medicaid as a pregnant woman pretty generously. I think it's 185%, might be higher than that now, above the poverty line. So I'm really curious about what the articulation of what qualifies as low income is.
Yeah.
And like who, that's a pretty broad umbrella. And when I think of TANF, users, I think of like the very low of the low. And then my question is, those are people that typically aren't working. So how are they living in that time frame after birth? Because in my experience with the shelter system is every family that I was working with typically was on TANF, that they did not have the means to get out of the shelter system using TANF. So that's a very different kind of low income than perhaps, a family using Medicaid or SNAP benefits, for example. Like there's an instability there. So I'm like also curious about that. Maybe as a qualitative question, I don't know. But I'm curious, like, how are you guys contending with that?
Yeah, I think so. Yes, you're absolutely right. There are many variations of poverty and low income. The middle, close to the poverty line, right? And like one of the questions that you ask is like, well, you're like Medicaid is generous. Oh, the only reason we use Medicaid is if we were just to look at TANF participation among all mothers, it's such a small group, it would get washed out. So we wanted to get like, what's a proxy-ish for low income-ish, and that's why we use the Medicaid to kind of narrow the focus. But yeah, I think the other things you're asking about are how are extremely low income mothers getting by at this time right around birth. I mean,
yeah, because if they're on TANF, I'm imagining that there's just pretty severe instability. And so what does that picture look like? That's very different than if you could continue to be on leave.
Yeah. Yeah, this is, so the group that, 2/3 or whatever it was, that are using it in short term, some of those people may be using it I think some of those people are using it as a pay food, but some of them aren't, you know what I mean? So some of those weren't working before and are returning to work and so on. So there's a lot more to do here. This is a very descriptive account of what the data is showing us right now.
Is your data set?
I mean, I think we've gone through a bunch of data use agreements, and so people, that network thing I showed at the beginning, almost all of those required some kind of data sharing, which was like years in terms of project. Anyway, I think there would be ways. So if anyone's interested, we could explore that.
So for people who like me who only live in the US or Papua New Guinea, what does policy look like in other countries? What are we missing here?
Okay, so the first thing is like people, they mock the US for not having a federal thing, but we're a huge country with like a state federalism model. So like this idea of states policies is built into our system. If you go to, a lot of people, I used to live in Canada. A lot of people live in Canada. Okay. So it's a 1/10 of the size of this country in terms of population and complexity, really. Right. So I think of, in some of these places, it's just easier to do. It's easier to have a federal policy when it's not as complicated. So I think that's one explanation. But as the Scandinavian, European models, it all comes down to like their taxation is a lot higher. They're willing to accept a much heavier role of government in their lives. And the redistribution from the haves to the have-nots is entirely different than in our country at a federal level.
How would this work relate to arguments for and against universal basic income?
Yeah, so that's a good question. I mean, it's really different from a policy thing, but the idea of providing all people a baseline floor is similar in spirit to what paid leave does. It provides universal coverage to all people. So, right, we didn't get into this that much because it hasn't been the focus of the work, but a lot of people, Inez is here, wrote her thesis on it. A lot of people have access to paid leave through their employer. So even though we'd have the map showing how bad the US is, I think, was it 30, 40% of workers have paid leave through their employer or a state provided one or something. So, in the US, you just kind of, if you're in a good place and you have that's how the US is an inequality story, right? You're in a good place and where you work at a good job, you're covered. Your life's fine. But if you don't,
this is a big difference between this and universal basic income. Is here your income depends on what you were doing before, whereas universal basic income, everybody's basically treated equally. And how would that relate?
Yeah, it's a little bit of a stretch to go to the universal basic income. So we can talk more maybe after. Yeah.
Maybe one more question about the presentation today.
I would like to ask, how did you collect the survey? Does all these participants, they know the goal of this research? What's the population? More of the population.
Yeah, so I was trying to explain that, but this is not from a survey. This is from what we call administrative data. These are records that the government keeps to monitor program usage and earnings.
You know how the government collected the data?
Well, so there's a birth record that you fill out when there's a birth event, and that gets housed at the housing authority. The Oregon Department of Human Services collects records of the TANF payments, who was on TANF, how much did they receive, and employment. All employers are required to report earnings for their workers.
This is a clarification. That's what I think the beauty of this project is the data aren't collected by a single source, right? But the project was to say, oh my gosh, there's all of these databases out there. What can happen when you put them together? Right? It takes a lot of effort, years of effort, just to match lines in a huge, huge database.